So, with surface anatomy of the leg, as with previous weeks, the good news is most of it's pretty straightforward. Bad news is there's one tricky structure, but there's more good news. The good news is the tricky one this week, not that tricky. It's not as hard as, say, head of the femur or popliteal artery. But a lot of people get it wrong first go. So I'll warn you about that now and then it probably won't happen. All right, now firstly, a bit of revision from last time. If you palpate up here where there's kind of muscle either side of the femur and you feel soft, if the person's relaxed, you feel soft muscle tissue, then you'll hit the epicondyles of the femur. That'll be the first bit, first bony bit you should hit. If you start up here where it's a bit soft, work your way along the femur, you should hit the epicondyles. Now what can be a little bit tricky is when you come inferior to the epicondyles of the femur and you're looking for the condyles of the tibia. They'll be there and you'll feel them, but sometimes it's hard to feel a gap between them. Now there is one, but it's small. So what you'll feel is a little indentation. That's the gap between the femur and the tibia. Now it's often more palpable on the lateral side. Okay, so look for it there more or feel for it there more. Now of course on a real life person there's not going to be as much space as there is on this skeleton. But there will still be a little groove there. Then you're on the tibia. Now the other way to check, of course, is to have the person sitting with their knee flexed to 90 degrees and you do the movement. You flex and extend their leg there and feel which bit's staying still and which bit's moving, and that should help hopefully. Now, so hopefully those ones are not too hard. If you're having any trouble, though, let me know. Then the bit that's often tricky for people the first time is the head of the fibula. And the reason I say people find it tricky is often they'll be palpating the tibia and saying, oh, is that the head of the fibula there? It's a little bit more inferior and posterior than most people think first go, okay? But it is really palpable. So once you've found it a few times on different people, you won't have any trouble. But it can be tricky just first time you're trying to find it. So make sure you have a go on as many people as you can, of course, ask permission and be gentle and respectful, but get your hands on as many people as you can, find the head of the fibula. Now, of course, on a lean person, you'll be able to see it. So it's really not as tricky as some of the ones we've done previously. It's quite visible on some people, but it should be palpable on just about everyone, because all around it is muscle tissue. So you should be able to feel a hard bump with muscle around it. Now, the thing is the neck is just inferior to the head, as you'd expect, and basically what you're feeling is the head kind of disappears. It's a bump, but where the indent below, where the bone kind of goes medially, is the neck. Now, what else might you feel on the neck of someone's fibula? No. There will be muscle tissue around it, sorry, so you're not wrong. I think if you said fibularis longus, that is actually true. But there's something kind of on the neck. And then the person might feel something if you palpate their femur. There's a nerve there. Which nerve is it? It's the common fibular nerve. It shouldn't have split yet, so it should still be the common fibular nerve. Inferior, it's wrapping around the neck of the fibula. So if you palpate there firmly, it can be a bit like the ulnar nerve, where you bang your funny bone. So the person might feel a sensation coming down their leg, but not necessarily. It doesn't necessarily happen. But if someone does feel that, it's just the common fibular nerve. You've just pressed on that. So be gentle, but you might even be able to feel it under your fingertips. You might be able to feel a stringy, soft, squishy structure coming around the neck of the fibula there. So that's epicondyles of femur, condyles of tibia, head and neck of fibula. Then we've got the medial surface of the tibia. Now that one should be easy, that's just your shin. If you're having any trouble at all, you've got problems, no. If you're having any trouble at all, find the medial malleolus first and then just work your way up. It's your shin bone, shouldn't be tricky. There's an anterior border. Now that's just the ridge right at the front. And again, if you're having any trouble with that, just find something hard, bang your shin against it, and you'll feel the...
A toe bar works really well.
Obviously, of course, don't do that. Yeah, but the toe, I did it myself on a toe ball the other day and went, oh yeah, anterior border of tibia. It doesn't help with the pain if you know the name of the structure, but it does distract you for a sec. So that's the anterior border. Now, you won't be able to feel the lateral surface of the tibia. Why not? Why can't you palpate that one? Yeah, the tibialis anterior muscle is sitting right there. So if you found the medial surface of the tibia and the medial malleolus, and you found the anterior border, all you've got to do, if you're in the proximal half of the tibia, all you've got to do from that anterior border is move laterally, you're on tibialis anterior. What are you going to do? What are you going to get the other person to do to help you feel the tibialis anterior? Dorsiflex their foot. Yeah, if they dorsiflex their foot, you don't have to resist it. If they just dorsiflex it and hold it in dorsiflexion, you'll feel the muscle belly of tibialis anterior suddenly contract. So if you do it when they're relaxed first, then get them to dorsiflex, that's a really good way to do it. You'll feel it. Now, on a lot of people, if they're lean and do cycling or running or something, it's visible. You see it when they dorsiflex. But even if not, even if it's not visible, you should still be able to feel it if they dorsiflex. You'll feel it working. Okay, it's the strongest dorsiflexor. It'll be working if they dorsiflex. So hopefully that one's not too hard. And again, lateral malleolus, hopefully not too difficult to palpate, just on the lateral side. Remember, it's a little bit distal to the medial malleolus. They're not quite at the same level. Now then we move on to finding some muscles. Now, with the person in flexion, remember this won't work too well in extension because there's a fat pad here in the popliteal fossa and there's fascia covering it, and that will all be pulled quite tight if the person is in extension. So this is best done with the person sitting 90 degrees, flexion of the leg at the knee. Again, find the hamstrings first. Should be nice cord-like tendons, easy to find either side. And then come down onto the tibial part of the popliteal fossa, and you should be feeling muscular. The tendon, there's not really much tendon here, it's mainly muscle tissue attaching into the bone, but you should be able to feel the lateral head and the medial head. And what you can do is run your fingers over them, like so, in a transverse friction kind of way, and particularly the lateral one will tend to kind of go clump and flick under your fingers when you do that movement. You can, even if you're doing it reasonably gently. The medial one's a bit bigger and a bit softer and doesn't tend to have that clump to it, but you should still be able to feel both sides, hopefully. If you're having any trouble, let me know. And you should, on some people you can see them quite easily, but you should be able to feel and see, in some cases, the medial and lateral heads of the gastroc on the muscle belly part as well. And then the calcaneal tendon, hopefully, doesn't present any challenges. Hopefully you can find that one fairly easily, where gastrocnemius and soleus together attach to the calcaneus. Go to it.